Hello and welcome to the leanvetpractice.com. This is a presentation on an introduction to lean in the context of the veterinary practice. And I hope you enjoy this presentation. It's quite lengthy, so dip in and dip out of it. Have a break, make a cup of tea halfway through, whatever. So let's crack on. Now, first of all, just a very quick bit about me, just so you know who is delivering this presentation. My name's Christian Bamber. I graduated from Cambridge seemingly a long time ago, way back in 2000. I've done a few things. I've owned a practice. I've done some businessy stuff as well, worked for charities. And I'm also a certified management consultant, so I do a few business-related things outside of veterinary practice, but also within veterinary practice as well. And this is where I have my interest in lean. So let's just skip that. Sorry. Here we go. Okay, what are we going to talk about today? Well, first of all, the burning question maybe, what is lean? So we'll look at the concept of lean and how it applies to us in the work we do. To do that, we do need to just look at a bit of theory, and it's all about processes. So we'll have a look at processes. Then we'll break lean down into what I sort of see as the three main elements, and that's lean tools and techniques, if you like, lean management, and lean philosophy. And then we'll look at what you can do with lean afterwards. So here we go. What is lean? Well, there are lots and lots of different definitions of lean. Most of them are correct. So the one I like is this one here. Lean is a culture of continuous improvement, practiced at every level of the organization and by every member of the team. Pretty much sums it up. Not too bad at all. We can be even more concise. It's a way of working. And after looking at so many different definitions of lean and wondering what to give you, I think that's pretty much as good as any. So, how does lean work? Well, lean is a way of working is all about delivering value. So lean creates value for customers, inverted commas, coming back to that, by minimizing waste, improving flow, and simplifying processes. So let's kind of break that down a little bit. Value is really what people are willing to pay for. And I've written customers in inverted commas because we're quite unique in veterinary practice in that we actually have two types of customer. First of all, there is the client who does the paying, or hopefully does the paying. And secondly, there is the patient or the pet who is actually the individual on the receiving end of what we're here to do. But clearly they can't physically pay themselves, nor do they probably have any sort of concept of what value is. So we have a proxy, and the proxy is the client. And that does make things a little bit more complicated. So in other industries like manufacturing, the customer is pretty clear who that is. It's the end person who wants to buy your goods and therefore is willing to pay for any value that is delivered through making those goods to the right standard. So here we have two customers. We have the pet and the client. The client does the paying bit, although a lot of our efforts really need to be balanced between what's valuable to the pet and what is valuable to the customer. So that's a little bit about value. Then one of the ways we achieve that is by taking away as much waste from our systems and processes and work as possible. Now, I'm not talking about sort of physical waste, although that is an aspect of it. I'm talking about waste as in waste of time, waste in efficiencies, that sort of thing, and we'll look more about that in a minute. And also, therefore, flow. If we have a nice flowing process, then there tends to be not much waste, and therefore we can deliver more value, more efficiently, more effectively, and simplifying things. I'm sure we're all familiar with processes that probably could be a lot easier than they are, and we made them far too complicated. So what? Okay, if we're delivering value to the client and to the pet, it actually has a knock-on effect. And one of those things is if we adopt lean, it actually makes us better vets and nurses. And the way it does that is because it removes a lot of the, well, as I've said here, constraints and barriers to what we do. So I'm sure we all know, at the end of the day, we can all familiar with being very frustrated by not being able to do this, not being able to do that. And it's because of the way we work. It's lots of little things that add up. Lots of little niggles that kind of affect the way we work, and have, when you add them all up, have quite a big impact. So what it does is, if we remove mistakes that we make, if we improve the efficiencies, that sort of thing, it actually makes us a lot better, a lot more careful, because we've got more time to spend on individual patients or the things that we're doing. It makes us more aware of errors and doing things right the first time, and lots of other things. So so as I've said here, processes are improved, errors are removed, and patient value is central to what we do. So we deliver a better quality of service. Okay, the other thing, therefore, is by delivering that quality, as we just said, we deliver a better service. The client and the patient are our customers, both of them, and they receive a better level of service, and ideally an exceptional level of service, because we put what they value, or in the case of the animal, what we perceive that they might value, if they could, at the core of what we do. Everything we do, the processes are built around them and delivering that value. And there's more. So this is one example of where better quality does actually cost less. There is a hidden cost of poor quality. There's an obvious cost of poor quality. So, if we have to do something again, it's time consuming, there's more consumables, that sort of thing. But there are lots and lots of little things that add up again. If we are delivering a poor quality service, it's very costly. And therefore, if we take out mistakes and wastes, then actually we are, as a business, we are saving money. So, okay, that might not be, if you're a vet or a nurse or a receptionist, and that might not be a big driver for you, but it is a collateral, or a corollary, I should say, of what we do, and certainly of interest to managers and senior staff members. So it is one example where quality does actually cost less. And one final so what, and I think for me this is a big driver, and this is why we should all be looking at lean for our practices. It will create a much happier staff. Morale is always boosted in successful lean programs. And we see that because lean is for everyone. So everyone should adopt lean and can adopt lean. The people who are most effective at delivering a lean program are the people at the coalface, are the frontline workers. They are the knowledgeable people. They are the experts. and therefore they are the best people to evaluate what is valuable and therefore create working processes around what is valuable. The way, as we will see later on, the way lean works is it is a big group effort, and it does require every single member of the organization to contribute, and each individual's opinion is as valuable as anyone else's, and therefore people are just valued more. Management, a good lean management, knows that the frontline workers are the experts. They know to give time to problem solving, to stand back from the day-to-day work that we do, the firefighting, and say, hang on, we know we've got an issue here. Maybe let's just try and address it rather than just crack on and muddle on through. Let's try and address it. And the people best to address it are the staff. So generally, they feel much more engaged and much more valued. So the provenance of lean, and a bit of history, I won't dwell on this, but lean has been around in some form, arguably for, a very long time. Henry Ford, as we know, was the sort of father of mass production, and that certainly, if the way processes work. What am I trying to say here? The way processes are these days can be linked to some of the improvements that Henry Ford made. And what happened was, when Henry Ford created his system of mass production, although that was great for doing what it says on the tin, i.e. mass producing, it wasn't very good unless you wanted variety or options. The famous phrase, something like, you can have any car you want as long as it comes in black. And that was true. There was no option for any variety options, whatever. And that's when this chap here, Taiichi Ono, from Toyota, that's when he began to take quite an interest. So he thought, right, yeah, Henry Ford is really onto something here. This is brilliant. But there isn't much room for any variations. So he injected the aspect of lean which allows for that, and brought in a sort of better version of mass production with variation options, a much better system of working. And they coined this the Toyota production system, TPS, and that is the real sort of forerunner of lean. And the Toyota production system is directly responsible for making Toyota what it is today, and that's the biggest producer of cars in the world. So they really did an awful lot of work on getting lean where it is today. They didn't call it lean at the time. As I said, it was the Toyota production system, but it is the forerunner of lean. And then this other chap from America, Edwards Deming, he introduced the quality aspect of lean. And he went over to Japan and helped Toyota to just up their quality quite significantly. And in latter years, I've lost the slide. Okay. So in latter years, in the last 20 years, what was called the Toyota production system, we now call lean. And there are a couple of chaps called Womack and Jones, and they are the sort of modern day developers of what we know as lean now. So who uses lean? Well, surprisingly, lots of companies use lean. I say surprising because you probably wouldn't know they use lean, but lots and lots of companies do. So we're all familiar with these. And it's not just manufacturing. So although the Toyota production system was a car manufacturer, lots of different organizations use lean, from of course, manufacturing all the way to various different services, financial services, charities, and even places like IDEX Laboratories, which we're all familiar with. They have a big lean program, certainly in the States. I'm not sure whether it's over here, but it is in the States. And of course, these are all big companies that you'll know of. But for every big company, there are lots and lots of smaller companies that use lean. Now, lean, it's gradually dispersing through the different industries and sectors. And in North America, lean is a big aspect of private healthcare now. And a lot of very successful private healthcare organizations are using lean. But I think healthcare is one of the last frontiers for picking up on this concept. And certainly veterinary medicine, I know of a handful of places in America that are using it. Excuse me. But, sorry, I'm just getting more comfortable. But little or no uptake over in this country. And that's what I really want to do. I just want to raise awareness of lean. That's what the leanvetpractice.com is about. And I think we are, as an industry, the time is ripe for having a look at this and thinking, well, can we use this? And we certainly can. But it's believing that we can use it to our benefit. Okay, let's carry on. So, processes. This is just the technical bit. Processes are everywhere. Pretty much any activity, whether it's in our private lives or whether it's at work, is made up of a series of steps to give a process, and that's it. It's a process is just lots of little steps in a chain. So I've used the example here of going to Starbucks as a process. You drive there, you park your car, walk to the building, etc., etc. Cleaning your teeth, there's a whole process involved with that. Steps from picking up your toothbrush, sticking your toothpaste on it once you've found your toothpaste, in my house anyway, and so on and so forth. And making dinner's a process as well. So I think we probably understand what a process is now. Processes have flow, so it's a flow of steps. A perfect process flows perfectly. So if we were looking at this as an illustration, here's a process with 6 steps in it. Doesn't really flow that well, as you can see. So that's a non-lean process. Whereas here's a lean process. Lovely flow. In fact, there's even less steps. We've taken out a couple of unnecessary steps. So that is a nice lean process. And of course, we get all the benefits that come with a lean process. Some processes, I'm sure you can relate to this, look like this. So the end result of the process is something quite simple, like fill a glass full of water. But from the beginning to the end can look a bit like this. And someone once said veterinary practice is a complex system of processes behaving badly. I cannot remember who said that, but someone did. So think of your processes, your process flow, like a river. So we can have a non-lean process, which is very turbulent, lots of white water underneath the surface. There are all sorts of big boulders getting in the way, producing this very turbulent river. And that's a non-lean process. And here we have a lean process. So very smoothly, steady flowing, no obstacles to contend with, just a nice, smoothly flowing process. That's what we need to aim for. Okay. That then brings us on to something called the value stream. So we have a process, which is a series of steps. Now, in an ideal world, every single step would be adding value. There would be no steps, no unnecessary steps, no duplicated steps, and no wasteful steps. So every single step adds value along what we therefore call the value stream. Okay, so we touched on this earlier. Who is the customer? And we have the obvious. We have clients and we have our pets or patients. But just to add an extra element to this, we also have the client, the pets. They are external customers, but we actually also have internal customers, which is what I'm representing here with this last figure. And internal customers can be anyone who is on the receiving end of a process internally. So an example of that might be a vet who needs a surgical kit prepared. So the nurses, etc., will probably clean the kits, cobble them together, package them up, stick them in the autoclave, etc. So there's the process, preparing the kit. The customer at the end of that process, who requires the value, is actually the veterinary surgeon in that case. So and there are lots of other examples, but that's just one way of illustrating who an internal customer is. Now, the other thing that we need to be aware of is what customers actually value. So we can all have a guess, and we'll probably be partway there, knowing what our customers and pets want. But sometimes we need to drill down a bit further, and this is where things like customer satisfaction, customer surveys come in. They are very useful for actually codifying what everyone values, and we need to know that. So for example, a client might want quick service. They want their pet to be treated well. They want a good, cost-effective service, and so on and so forth. We have to sort of maybe guess what our patients want, because we can't ask them. But the chances are they might not understand what value is, but they probably know the difference between feeling rubbishy and feeling well. And I think it's safe to say they probably don't want to feel rubbish. And in case of cats, I'm sure they don't want to spend terribly long in the veterinary practice itself. So these things we need to bear in mind. So if we know what's valuable, then we can design our processes to deliver as much of that value as possible. So excuse me. So there are three kinds of value. The one that we need to be aiming for at all times is value added, or VA for short, and that is any process or activity meeting the criteria of adding value. And I've written left there because I used to have a box which defined what value was. In a nutshell, value is something that owners or people are willing to pay for, and that is done right the first time. So we're not providing them with a bad product, a broken product, whatever we do for them is got to be done right the first time. Then there are two classes of non-value added activity. So the first in the red, non-value added, any process or activity that isn't adding value from the customer's perspective, of course, is non-value added. It's a waste. Get rid of it. However, there's an in-between kind of value or non-value, and that's necessary non-value added. That's a process or activity that is not deemed valuable by the customer, but is, however, necessary to provide that product or service. So that's kind of the red tapey things. Maybe even writing clinical notes, not directly of value to the customer, but we got to do it. Lots of things like that. In fact, an enormous amount of our work is necessary, non-value added, and even more is actually non-value added. So that's what this little chart at the bottom represents. If you took your day's work and you looked at it by time, or even just an individual process, Doesn't matter, it's going to come out the same. You have a very small fraction of what is genuinely value-added activity, and we have a much bigger chunk of necessary non-value added, and then normally a giant chunk of non-value added, the other one being necessary non-value added. Messed that up, but you get it there. It's represented there. So what we should be doing with our lean program is trying to eliminate all of the non-value added and as much of the necessary non-value added as we possibly can, therefore increasing the proportion of value added activity. So another concept is called Kaizen, or known as Kaizen. It is, in a nutshell, the word for continuous improvement, and that is one of the pillars of lean, and that's to constantly try to improve what we do. Not necessarily massive radical changes, but lots and lots of little things. So when we look at some of the tools later on, you might think, well, crumbs, that's such a that's improving such a tiny aspect of the business. Is it actually really worth it? And yes, it is, because through the philosophy of lean, you're in this mindset where you're always looking to continuously improve. And if we actually use perfection as our end goal, rather than looking at, when we look at performance figures or comparing ourselves with the competition down the road, actually forget about that. Just actually take the perfect process or perfection as the end goal. Now, it's not going to be attainable, but if that is always our end goal, then everything we do is going to be working towards that. And this is what this chap, Vince Lombardi, he was a famous American football coach, and he said this, and there's a lot of value in this phrase. So it's aim high, and you're always going to do well, and that's what continuous improvement is just constantly being in this mindset of trying to improve, even if it's tiny little bits, everything we do every day, in every aspect of our work. And that is for everyone, whether you're support staff, whether you're on reception, nursing assistants, whatever. Just try to improve everything you do bit by bit. So just a slight improvement on the definition of lean, or how it works. Lean creates value for customers by minimizing waste, improving flow, and simplifying processes along the value stream in the pursuit of perfection. And that is probably as accurate and concise as you can get. Unless you're happy with the one I came up with earlier, which is it's a way of working. Sorry. So those are the key elements: value, minimizing waste, improving flow, simplify your processes along your value stream, always aiming for perfection. Okay, so the 3 elements of lean: it's a set of tools, it's a management system, and it's a philosophy. So beware here, because many a lean program has failed because people only look at the very first aspect of this, the set of tools. To some, that's all lean is. And you will get improvements if that's all you do. You take some of the tools, you go away and you work with them. You will get improvements, but it isn't going to be anywhere near as successful as a lean program could be if you also have a lean management system and a lean philosophy. And they all need to work at the same time. Okay, having said that, we will look at the tools now. This is perhaps the fun bit of lean. This bit that people can go away and start to use. So, tool 1, the 8 wastes. Business waste in Japanese has a word. It's called muda, and that is what we are here to try to eliminate. Now, to help us recognize waste, it's been broken down into 8 categories, sometimes more, sometimes less, but 8 categories seem to work. You don't have to define right down to the button every single waste in your process or business, but this just helps you recognize the different types of waste that are out there. So let's have a little look. Here they are. Here are the 8 wastes. We have defects or errors. We have the waste of overproduction. Not necessarily a big one in the veterinary practice setting, but it can be there. We have the waste of waiting, and I'm sure we're all familiar with that one. The waste of non-utilized talent. We have transport waste. That's sort of carrying things, pets, and other things around the practice. We have waste of inventory. Waste of motion. That's us, staff moving around all over the place. And we have the waste of extra processing. We'll look at that one shortly. So, just before we look at the individual wastes, a couple of vaguely interesting facts. 20 to 30% of healthcare spending is waste in America. That's a US statistic. And that frighteningly equates to about $1 trillion. So rather a lot of money. And here's one that we can probably all relate to. Only 31 to 34% of nurse time is spent with patients. That is another American healthcare statistic. But I think it probably is similar for veterinary nurses over here. Okay. The first of the 8 wastes, defects. I think this one is self-explanatory. Defects, the waste of defects is really directly the time spent on an activity which is done incorrectly and therefore either needs fixing or causes potentially catastrophic errors down the line. So here are a couple of examples. Clipping up the wrong leg. At worst, it could mean chopping the wrong leg off or operating on the wrong leg. At best, it's just a waste of time if we recognise it in time, because then we've got to clip the other leg up and doesn't look terribly good. So that's an example of defects or errors. Then we have overproduction. As I said, this one's not a biggie. Remember, these stemmed originally from manufacturing, although they're equally applicable in healthcare. But not such a big one for us. But there are, I think there is one part of overproduction which we see it too much of still, and that's too much paperwork. I think there are many practices out there which are still relying on paperwork too much, duplicating paperwork, just generally too much paperwork. A lot of this stuff can be done electronically now. It just requires a little bit of effort up front to arrange your systems and processes so that we go a bit more electronic and paper friendly. Oh, here's another example, overproduction example. However, some of you might be familiar with this scene. I want to send a blood sample off for a T4, and I type in T4, and oh my goodness, here we go. I've got to choose from this. Now, it's great if I know exactly which company we use or what the test is, but out of all these here, there's probably only 3-4 T4 tests that we actually use, and all the rest are just too many options. And if you're not familiar with the system, if you've got locums in or new vets, they're going to spend an awful lot of time wading through these, probably not coming up with a decision, and then having to go out and say, oh, which T4 thing do I need to? Oh, I don't know. Go and ask so and so. Oh, okay, so on and so forth. So that's an overproduction example. Too many options. Get rid of them. Waiting is everywhere. We can be waiting for clients. Clients can be waiting for us. We can be waiting for things to happen. Any period of time where you're waiting for the next activity to happen, and it's not. So you can understand that waiting is clearly everywhere. Here's a little thing I did the other day. I at a pretty good practice, pretty efficient, not bad. I added up the amount of time I spent waiting, just the waste of waiting. So that's doesn't include time that I've gone off for a cup of tea or whatever, or lunch. It's just non-value added activity due to the one waste of waiting. And it came out at about 62 minutes a day on average, which is 10 days a year. So 10 days a year, someone could be paying me to be a vet, and I could be going in and basically sticking my feet up on the table and drink tea for 10 days of the year, which is, might be great. You might think, oh, so what? I'm getting paid to do nothing, but it's not adding value. It's not adding value for the customer or the patients, and actually is a great source of frustration for most vets and most nurses. So that's just the time from non-value added. There's an awful lot from necessary non-value added, which then starts to become quite frightening when you combine how much time is probably wasted due to waiting from those activities. 10 days a year is probably an awful lot worse than that in some other practices. Okay, so other areas where we wait. Another real big one for me is waiting for infrastructure to do its job. Often that is computers, whether it's hardware or software. I get so frustrated by the end of the day battling with poorly designed software systems or lack of investment in hardware. It's a great source of frustration. And again, it's, when you start to look at the amounts of time involved in waiting and actually equate it to days per year, or even put a monetary figure on it, really the investment that would be required to upgrade some software or upgrade some hardware probably is insignificant to the actual amount of time and cost and frustration waiting across a year or so. So yeah, computers, that's a biggie. Okay, another waste, non-utilized talent, and this is where lean really mops up, if you like, because lean is designed to maximize everyone's abilities, and it actually brings it out of people as well. So if you think we have this sort of latent talent pool, some people just don't want to come forward and give their ideas. Maybe they're just not confident, or whatever. Maybe they don't even think they have anything useful to contribute when they probably do. Some places just aren't geared up for it, so you might have a management system whereby no one's going to be listened to, and that's possibly the worst kind. Again, lean addresses that. So if you have ideas and you're not listened to, it really does put you at great risk of getting staff burning out, getting fed up, and not giving a toss about the business. So this is where you've got to have the management system as well as the philosophy to back up your tools. Okay, I came up with this, quite pleased with this. Use your nut. That's my contribution to the lean world. Just a way of remembering. Non-utilized talent. Use it. Okay, transport. Often badly laid out practices. Not necessarily the walls, but in many cases, we're in old buildings that can't be changed. But sometimes just even thinking about where we position stuff within those walls can make us run around carrying stuff to and fro, whether it's patients or drugs or orders or whatever. So there is a waste associated, a waste of time and energy associated with carrying things around. Sometimes we could just come back a bit, sit back a bit and say, well, can we design this a little bit better? and that would lead to much less transport waste. Inventory is pretty obvious, I think. So if we've got stacks and stacks of stuff on the shelf, it's taking up space, it's taking up resources, it potentially could be going out of date. I think we are better as an industry with our inventory or stock control, partly because we have this just-in-time system now where we can order stuff one day and get it the next. But it is surprising how much can be still wrapped up in your stock that is unnecessary. It can run away with you. It's one of those things that can just, you think it's okay, you're on top of it, but over the course of several months, that stock or inventory amount can start to grow. So keep an eye on it. Here's a good one. I like this one a lot because it's everywhere. Motion. It's a bit like transport, but it is really just the motion that vets and nurses do. Not carrying anything, it's just what we do. Again, often due to poor layouts or just not thinking about the process itself. So one way we can look at motion and the waste that we see with it is by doing a spaghetti diagram. And that's where we just map the course taken by a member of staff as they are conducting an activity or their work. And this is a real example. So this is somewhere where I work. This is a plan of the prep room. And the practice has a policy of putting in IV cannulas to any patient that's admitted for an operation or is admitted for a medical workup. So it's a busy practice. So we were probably doing this maybe 8, 9, 10 times a day, maybe more. And what happens is when we say make the decision to pop a cannula in, we get this pattern of motions. So I asked the nurse to cobble together everything we needed to put a cannula into the next patient. I stood back and mapped her progress, and this is what we've got. This is an awful lot of motion and activity just to pop a cannula in. So we've got 1, 2, 3, 4, 5, 6, 7. We've got 10 plus touch points here, which does seem a bit excessive. When the simple solution is to do this, which is each day or each week put together everything you're going to need for putting a cannula in. And you can do this with any common procedure or process that you do, rather than do everything individually, every single step. Go and find the soft band, go and find the blood tube, go and find this, that, the other. Just have it all together, whether it's in a trolley or a tray like this. It's such an easy solution. And when you think, let's go back, when you think this is being done 8, 9, 10 times a day, it's a big waste of time. And you can even, if you're really, really keen, you can even just map yourself now or measure how far you're going in a day. Okay, so solution, often and this is the thing with lean, often the solutions to the problems are very simple. Sometimes they're not very elegant, but they're so simple. And if you address these little things, and you just keep plugging away with your continuous improvement or your Kaizen philosophy, then you're going to make your working environment so much better for yourself, so much less frustrating for yourself, and you'll be adding value for the customer, the client, the patient, all the way. Here we go. Extra processing, the final waste that we see. This is doing any kind of work that is not perceived as being valuable by the customer or is perhaps not aligned with the patient needs. So I think possibly a biggie here is maybe overprescribing antibiotics or any other unnecessary medication, or performing too many diagnostic tests. There you go. There's my IDEX lab that I want to submit. Okay, it's a bit excessive, but it probably happens in places where we just take everything, and it's unnecessary and it's not valued. Okay, so we said Muda was the word for waste. Therefore, what we just need to do when we're looking at our processes, or when we are working at any point during the day, we need to just pop our Muda goggles on now and again and just look for waste that might come under any one of these 8 categories. Once we've identified it, then we can look at getting rid of it or at least reducing it. But we can't do that unless we can recognize what the waste is and where it is. Okay, a second tool, value stream mapping. We talked about the value stream earlier. So it is just the stream of activities that value builds up across or along. A value stream map, therefore, is a step-by-step visual representation of one of the key processes of a business. It tends to show flow and it tends to show data. So it's a little bit more than a process map. And so key value streams, examples of value streams. Well, here's a value stream which we all see every day. A pet it needs a vaccination with a vet, that's it. But there is a whole chain of activities along the stream where we need to be adding value. And it starts from when the owner picks up the phone or perhaps calls into the practice and makes that appointment, that very first touch point with the receptionist on the phone or in person. That's when we need to start adding value. And it will progress. So we then will end up with the client coming in and waiting and then going into the consultation, leaving the consultation, going back to reception to pay, and finally leaving the building. And that's when the value stream there, in this case, finishes. Another value stream example, a pet needs a repeat prescription. So again, the owner contacts the practice, and then there is a chain of events that occur which eventually lead to the point where the owner can come and collect the prescription. Here's the internal value stream example that we mentioned earlier. So a vet needs a surgical kit to perform an operation. So that all starts with the surgical kit originally coming out of the cupboard after it's been stored, being laid out properly, then the vet using the kit getting cleaned, packaged up, popped in the autoclave, etc. So there is a value stream there, and that's an internal value stream with an internal customer, the vet. Okay, what's so good about value stream mapping? It helps you to understand your processes in detail. It's surprising what you think you know and actually what a process actually looks like when you put it down on paper. It takes you to the gemba. The gemba is another Japanese term which means where the action happens. And when you go through the process of value stream mapping, you really need to actually physically go to where that value stream is occurring and walk through the steps. The way I kind of look at this is when we are monitoring, or when a nurse is monitoring an anaesthetic, she doesn't do it from an office. She doesn't even do it just being in the same room, relying on the machines. We're taught that we use the machines, yes, but we still have to physically get our hands on the patient and take our measurements. And it's kind of the same for managing a veterinary practice, or in this case, looking at the value stream map. Don't look at it from afar. Actually go where the action's happening, because it's the only way you'll really know what's going on. And this is what we call this the gemba. Go to the gemba. We check every step's necessary in a value stream. That's one of the first things once you have your process mapped out. Is each step necessary? Then we look at the flow. What's the problems here? Where are the bottlenecks? Where are the points where there's a common recurring issue? We can then look for our non-value added areas using our 8 wastes, and then together in a group, because all value stream mapping is always done with a mixed group of people. Then we can look at the process and look at it with a view to improving it. So this is the start. So when you are doing a value stream mapping exercise, you might say, right, I want to today we're going to look at the value stream for repeat prescriptions. So everyone gets together. You don't just have vets, you have nurses, you have receptionists, anyone involved, even sometimes a client. So anyone that can give some kind of view. You map out every step in the process. You see whether all those steps are necessary. You look at, identify the problems, and then you start to address them. And what your value stream map starts to look like is this. Now, we don't need to look at what each of these things mean, but everywhere there's a blue sticker or a yellow sticker means there's an area for improvement. So in this case, it's actually a value stream map for a pet that's being admitted for an operation. So this is now a value stream because we have the idea of the flow and we also have data. The little up and down line on the bottom is actual time, so value added times versus non-value added times. So we can look at the timing, but then we can also look at the areas for waste and then areas for improvement. And so we go from this, which is what we call a current state map, because it represents how the process currently is. Once we've done all our little tweaks and come up with some ideas to address the problems, we have our future state map. And this is exactly the same thing, but you can see immediately there are less steps. There are less steps. There are a couple more parallel steps, and the overall, what we call the lead time from beginning to end, is much reduced. Now, time may not be a critical factor, as it is perhaps when you're producing goods and manufacturing, but remember, we don't want patients hanging around because they don't like it, and also it is taking up resources whilst they're in with us. And okay, you might think, oh well, they need monitoring. That's true. So we still do that, but at the point in time where we deem them fit enough, healthy enough to go home, that's when they should go home, not a couple of hours later when it's convenient for us to discharge them. So the future state map is the all singing, all dancing map, which then, of course, we have to go and implement. We'll come on to that later. With the traditional concept of both management and working, we often view organizations as departments, and even very small organizations or practices have our departments. And in its simplest form, we might have this: a reception, the veterinary body, the nursing body, and administration. And sometimes it's very easy to say, well, if I'm a vet, what goes on at reception? I don't really know what goes on out there. It's not really my issue. That's reception deals with that. And that's kind of what we need to step away from, because if we're thinking about a value stream works as a stream that goes across horizontally all of these departments. So if we are interested in value and we are interested in the value stream, then we are interested in every step and every area that the value stream cuts across. So we shouldn't be saying, as vets, we shouldn't be saying, well, what goes on at reception isn't my concern. We should actually be concerned with it because it's part of the value stream. There are different value stream versions. There is, what do you think a value stream is? So if you were to ask me cold, what's the value stream with someone wanting a repeat prescription, I could give you a verbal idea of what happens. I might even be able to say, well, it's a bit of a faff, so ideally it should be like this. However, once you get together and you start getting it down on paper, there is what it actually is, the current state. And the current state is generally a lot uglier than what you think it is, and certainly a lot uglier than what it should be. And then there's also what it could be. And what it could be is when we actually make the improvements collectively. So when we have a group of people together working on a value stream and what we come up with as the ideal scenario. So the two that really matter to us, what it actually is and what it could be. And this is what we want to go when we do our value stream map. We map the current state, i.e. what it actually is, and then we move to the future state map, and that's what it could be. And that's then what we need to go and implement. So those are the two ones. So, this one, what you think it is and what it should be, forget about them. It's irrelevant. There is really only what it actually is and what it could be. Okay, I'm just going to take a break here, I think.